All right, we're just going to let the last few participants come in. I want to welcome you to the annual Public Health Graduate School panel. My name is Elisa Crossman, and I'm an undergraduate advisor in the Herbert Wertheim School of Public Health. Tonight's event will consist of 3 parts. First is a short presentation. Second will include perspectives from each of our 6 panelists. The third will be a Q&A session informed by questions submitted in advance by webinar attendees. For more information about graduate school, visit the Planning Your Future tab at ph.ucsd.edu/undergrad. I want to remind you that tonight's event will be recorded, will be available on the Public Health website following the event. Now I'd like to welcome Nadia Mei, Pre-Health Advisor in the UC San Diego Career Center, to talk about graduate school programs, options, and applications.
Hi, hello. Thank you, Elisa. So today I'm going to talk to you about graduate school options for public health, as well as admissions considerations and other options you can pursue after you graduate. So public health is such a broad scope. It covers so many different disciplines that it can be overwhelming to kind of decide what career path you're most interested in and kind of how to achieve those goals. So we'll go over some steps today. Next slide, please. All right, so as you're kind of thinking about pursuing a program in public health or graduate school, you kind of want to assess, what do you need to further your education or training, and how will a graduate degree enhance your career path and your long-term goals? Not all jobs require a graduate degree, but you also want to think long-term for what will this help you with? Also, what area of public health or healthcare are you interested in, and what type of schooling will you need to do for that? You also want to think about too, do you need to get other types of experiential opportunities such as clinical, research, service before you would apply to a certain program? Maybe they have criteria where they would want to see certain types of experiences. Also, the length of the program is very important. Do you want to do a full-time program that's 1 or 2 years, or do you want to be able to work full-time and kind of take classes one at a time? Also looking into the financial investment that you would need for graduate or health professional school, in terms of how would you need to plan for that? Would you want to work for a couple years, or would you want to just go right away? Next slide, please. And this is a kind of a snapshot of all the different graduate programs that you could pursue. And there's even more than this. So after you finish your bachelor's degree, you could look at doing a master's program, and there's a master's in public health option, master's of science in public health, which would be more science-based, master's in public administration, or master's of healthcare administration. So typically with a master's degree, this will prepare you to practice in public health, to possibly do research. This will also help you be able to apply for more jobs that maybe are a little more experienced, such as maybe federal, state, nonprofits, private industry. The next stage would be a doctorate degree. And there's different combinations of doctorate degrees or PhDs that you can get. You could do a doctor in public health. You could just do a PhD. You could also do a combination of an MD, MPH, PhD program, an MD or MPH, MD, a DO or MA PhD. So with these doctorate degrees, typically it'll be for somebody who wants to maybe work in academia or research, work more at a leadership level, maybe with a healthcare agency or the CDC. And then the third option is a joint combination degree. And as you can see, for almost every health profession, such as MD, DO, PharmD, vet medicine, there's a combination where you could find a program with an MPH degree. You could also do an MBA, MPH, or a master's in science, social work in an MPH. So the possibilities are endless. Next slide, please. And as you're kind of thinking about the different degrees, you also want to look at what type of practice do you want to have? Do you want to have something that's going to be more direct patient care experience, hands-on, such as working as a physician or a nurse, a vet, a dentist? PhD would tend to be more research and discovery. Do you want to work in research or academia? Master's in public health is very broad. You could do any number of things with it, whether you want to work in healthcare policy and development, things like that. Combining, medicine and science and MD, PhD typically is for somebody who wants to have the clinical practice as well as the research and possibly academia. And then the MPH, same thing. You want to do practice as well as maybe do the research side or leadership. Next slide, please. So for the different programs, you pretty much do have to be a lifelong learner in any one of these programs, but in terms of acquiring new knowledge, MD is going to be a little bit more limited in scope. You're going to have to go to med school as well as then do your residency. A PhD, you're going to have a lot, it's going to be broader. And then MD, MPH will have the combination. In terms of self-directed learning, it can vary by program too. Length of school is huge. Obviously, MD is going to be kind of the longest if you do MD plus your residency. PhD is also a pretty lengthy program, 4 to 6 years. And then if you do a combination, you're looking at 7 to 8 years plus. All of these programs require, I'd say, a good amount of significant, memorization and things like that. We'll go to the next slide. Perfect. So this is just 10 common areas in public health. There's so many different areas even within this, but here's a few: biostatistics and informatics, community health, epidemiology, global health, maternal and child care, public health, nutrition. And some of these programs will have combinations of different areas too. And in addition to this, there's also some new and emerging areas too. Next slide. So in addition to pursuing a graduate degree, you could also look at doing a certification instead, or as a complement to your degree, or even a certificate, say through extension. So there's a couple different public health certifications you could get. One is a Certified Health Education Specialist, which is CHES. There's also being certified in public health. FEMA has a number of different certifications. And UCSD Extension has a pretty robust healthcare program. They have over 20 certificate options as well as programs, or you could even just take classes under certain healthcare areas. Next slide. So as you're looking at other post-grad options, you don't have to go to grad school right away. A good option is to get different types of work experience and really kind of explore different areas of public health and see what you're interested in, or maybe what you're not interested in before you actually pursue a graduate degree. We talked about maybe getting a certification or continuing your education, but there's a number of really good internships and fellowships that are available for students who are interested in public health or even other health professions. So a couple of things listed here would be Peace Corps, Teach for America, Project Horseshoe Farm, Scribe America. NIH also has a post-bac program, which I believe is a 2-year research program. So these are all great opportunities to kind of get your feet wet in public health before you decide, what you want to do after. Next slide. Another important thing is kind of thinking about how do you want to contribute to public health? And throughout your career, as your career evolves and as the world changes, which is changing a lot now, your jobs within public health may vary. So you might be interested in grant writing or public policy, being a health educator, or even a healthcare practitioner, such as a nurse, a dentist, a pharmacist, a veterinarian. You may even want to just work on the research side, whether it's epidemiology or bioinformatics. There's also a huge need for occupational health, safety regulators or inspectors. With public health, most injuries, accidents, diseases are preventable. So they're always looking for people within these areas for different regulatory areas. Also, health informatics analyst is another position. Or you may just want to be on the research side or a faculty member, working in a nonprofit or even project management. There's positions for that in every aspect of public health. Next slide. So as you're deciding what type of graduate program you want to consider, you want to see what's really important to you. For some students, it's the location of the program, or it's the, it's the cost of the program. But you also want to look at the program, the concentrations or the tracks that are offered. Some programs will just have a focus of being epidemiology. Some will have global health, or child and maternal health, or community health. And some you'll actually be able to choose multiple areas that you could, take concentration or tracks in. Also looking at the delivery of the program. Is it online? Is it in person, or is it a hybrid? Is it a full-time program where you couldn't work while you're in the program, or could you have some flexibility? Also want to look at the program accreditation. For public health, you want it to be CEF accredited. And then some schools are regionally or nationally accredited, but you would want to look at all the different types of accreditation. Also, what does the program entail? Are there experiential opportunities where you could get research or clinical or internship experience? What's the mission statement of the program and the reputation of the program? Does it align with your interests and what you want to do? The class size could be important too. Do you want to be in a smaller class size, or do you want to have a huge class size? And also looking at program outcomes, where are the graduates going? Where are they working? Are they continuing their education? And what are their job titles? What companies or industries are they working for? That's a good indicator that it's a solid program if they're tracking graduation and outcomes. And also what kind of support is in the program, not only academic, but career support to help you to make sure you can get the job you need after you graduate. So these are just a few considerations. Everyone has different things that they look at, but you want to make a list of what's important to you so you know how to target your choice of schools. Next slide. So when you're looking at programs, you also want to look at the admissions requirements, such as what course prereqs do they require? Is there a minimum GPA? For most programs, it's usually a minimum of about a 3.0, but for more competitive programs, the GPA could be higher. Also, if it's a more science-based program, such as epidemiology, they may have a GPA requirement in certain prereq courses under maybe biology, chemistry, physics, or math. You'll typically need a CV and resume for all programs. You'll also need a couple letters of recommendation, usually 2 to 3. And you'll want to see if you need a certain type of recommendation letter. Some schools may require a letter from a science professor or from an experience in public health. You'll also want to make sure that you have all your transcripts from all the institutions you've attended to be able to send those. Application essays will vary by program. You'll have a standard prompt of like, why do you want to pursue public health? But you also really want to be ready for school-specific essays. Why do you want to attend this school? Why are you interested in public health? What are your career goals? And you want to be able to really talk about your strengths and your passions, how activities that you have done reflect your path on public health, and kind of how that will contribute in the future to what you want to do. Some schools do require the GRE. For this particular cycle, over half the programs did make the GRE optional because of the pandemic, and some schools are actually permanently moving away from the GRE. But usually if you do want to apply broadly, you want to take the GRE. Some schools will also take the MCAT, the DAT, the OAT in place of the GRE, as long as you have a standardized test from a health professional program. You also might have to be ready to give a sample of your writing, depending on the type of program too. Next slide. And I just briefly want to go over a few resources we have in the Career Center. We have our brand new HealthBeat career guide that just came out, and this has really an overview of 10 different health professions. We talk about admissions requirements. There's resources for DACA and international students, post-bac and special master's information. And this guide is really set up like a workbook for students, whether they're just starting their career or they're close to graduating. We also offer drop-in advising Monday through Friday from 10 to 3, and it's on our website if you just go to healthbeat.ucsd.edu. Perfect. Apparently UCSD MPH is waiving the GRE for this application cycle. Awesome. All right. And then we also have UC San Diego LinkedIn Alumni Network, and that's for anyone who's a current student or alumni can join that. That's just a great way to network with alumni who might be in grad school or might be in a career that you're really interested in getting into and you want to talk to them more. Triton's Connect is a brand new platform, and they just came out with an app. It's for alumni, staff, faculty, and students. Another great way to connect and find out more about an industry or what's going on. And then Handshake is our platform for searching for jobs, internships, career resources. You can schedule appointments through Handshake. And then we also have career fairs and webinars. Sometimes school admissions will come in and do an event, or we'll have employers come in. We also want you to take a look at our Facebook page, which is just at healthbeat.ucsd. And then our Instagram is at healthbeat_.ucsd. All right, thank you so much. I will pass it back to Elisa.
Thank you, Nadia. I now want to welcome our panelists. We have 6 panelists this evening, and they will be introducing themselves in alphabetical order, after which we will have the questions we have collected from attendees. So the first panelist that I would like to introduce is Sneha Challa.
Hi, everyone. Thanks so much for having me. Again, my name is Sneha Challa, and I currently work as a research analyst at UCSF. And I'm also a recent graduate of the UCSD Joint Doctoral Program in Public Health. Um, and I guess a little bit about my background, I initially was drawn to a career in medicine when I was an undergrad also at UCSD. But at the time, there were fewer options to kind of explore public health. So it wasn't really something I considered then. But I took a few courses as part of my minor in the urban studies and planning department that focused on the US healthcare system and also on preventive health, which is kind of what pulled me into the public health space. Um, so I chose to complete my MPH at the University of Michigan, focused on health behavior and health education because of the strength of the program and also just its focus broadly on health equity. And I also just wanted to live outside of California for a little while. So while I was there, I really developed my interest in research and specifically working in global women's health research. Which is why after that, I decided to come back to San Diego and pursue my PhD and had the opportunity to work with the really great faculty at the Center on Gender Equity and Health. And during that program, I focused primarily on studying family planning in global contexts. And I'm currently continuing my training at UCSF, hoping to kind of in the longer term, continue contributing to the reproductive health field and also furthering my skills to advocate for women's rights.
Awesome. Thank you, Sneha. Matt, the next panelist I would like to introduce is Matt Chen.
Thank you very much. Thank you for the introduction, Elisa, and it's my pleasure to do this graduate panel talk first time. So let me introduce a little bit about myself. So I'm currently a third-year biostats PhD student at UCSD, and before I joined the UCSD biostats program, I majored in biostats at the University of Pennsylvania, so in the East Coast. So during my time at UCSD, I worked as a researcher at Morris Cancer Center in the Department of Cancer Prevention and Control. And my work involved, most of my work involved large healthcare data analysis. Most of them are longitudinal, functional data analysis, survival analysis, and causal inference of both randomized control trials and observational studies. So the daily work is that I'm working closely with the PIs and the lead statistician, running the analysis and writing statistical sections. So much of my analysis used non-parametric methods. So out of the research, I also love teaching and had some great teaching experience at both UPenn and UCSD. And outside of work, I'm a quite an active person, love hiking, skiing, working out, even though that probably didn't get much chance to do this year, and hang out with my friends. And yeah, and that's a very brief introduction about me. And if you guys are interested in any kind of biostatistics related research topic, I'm very happy to answer any questions related to that. Thank you.
Awesome. Thanks so much, Matt. Shelton, excuse me. I would like to introduce our next panelist, Shelton Lo.
Hey everyone, thanks for allowing me to be here today. So my name's Shelton. I graduated from UCSD with my bachelor's in public health and then also my master's in public health, just like some other panelists as well. Previously, my career path was in medicine, took a few introductory courses, realized that wasn't my cup of tea, and then went over to public health, and then basically realized that public health really is really involved in meaningful work just as much as medicine is. So that's where I changed my career path and really went from there. At UCSD, it's been a great time and journey. Being in their BSPH and MPH program, definitely was a great experience. I feel like it definitely really prepared me to really tackle public health and the current issues that we're facing. And I would say, when I started in my bachelor's and master's in public health, I was very interested in health behaviors. But over time, as I got involved in other studies and other research projects, I realized that I really enjoyed working in environmental health and occupational health, and that's what I'm currently doing at Harvard T.H. Chen Public Health. Um, so, my current interest is in relation with environmental health and health behaviors. I try to mix the two together. So hopefully in the future, I could be able to, make some meaningful work in that field. But again, really glad to be here. And if there's any questions, feel free to reach out to me. Thank you.
Thanks so much, Shelton. And our next panelist is Cecilia Rangel-Garcia.
Hi, everyone. I'm Cecilia. I'm a fourth-year medical student here at UCSD and completed my MPH last year, or I guess in June of this year at UCSD. I'm currently applying into psychiatry residency, which I'm very excited about right now. I attended Loyola Marymount in Los Angeles for undergrad, and I knew I wanted to pursue medicine after college, so I intentionally chose to pursue a degree in psychology, not biology or anything, in college, and took just like all my pre-med courses on the side. And I volunteered at a health clinic during college, which has kind of really solidified my decision to pursue medicine. Volunteered with some organizations I was very passionate about and did a little bit of research. And I knew that medicine would be a way for me to get back to my community, use my great privilege that I have for good, and importantly, honor the work and the efforts of my parents, grandparents, and all of those who've come before me. I felt like medicine was a great way to do all of that. After college, I took a gap year to apply to medical school, and I was a scribe in an emergency department, which is an experience I highly recommend. And then I enrolled at UC San Diego as part of the PRIME program in 2016. And PRIME is a program that's at all UC medical schools except for UC Riverside, where students are supported in their commitment to work in under-resourced communities as a physician. So at UCSD, we specifically learn about health inequities and ways to address this major issue. And through the program, we are also supported financially to obtain a master's degree. And as I mentioned, I was at UCSD for that MPH, which I believe was a degree that could really, I could integrate my medical degree in the future in what I wanted to do. In terms of psychiatry, I've always been passionate about mental health, and I look forward to combining my public health and medical degrees to serve the communities I'm a part of. I envision working in schools to implement mental health literacy for youth and families, working in juvenile detention centers to intervene in the school to prison pipeline, and always working to eliminate health inequities and addressing racism in medicine as a psychiatrist, public health professional, leader, and advocate.
Awesome. Thanks so much, Cecilia. I would next like to introduce Elizabeth Terrazas.
Thanks, Elisa. Can you hear me okay? Okay.
Yes.
Okay. So thank you so much for having me. I'm really excited. I am a UCSD alum, so it's always nice to come back and be able to give back to the students. I did kind of always have a passion for healthcare. Ever since I was in high school, I would volunteer in hospitals. My mom is in the field, and so I was kind of influenced that way to pursue a career in health. Specifically, when I first started at UCSD, I was a pre-pharmacy major. And then as I took the classes, I felt like there was something missing, kind of that human aspect. And so I started taking classes in anthropology and sociology, and I was really drawn to that human connection. And interestingly, my academic advisor at the time recommended I take some classes in public health, or at the time it was called healthcare social issues minor. So I started taking those classes, and I just completely fell in love with the field. I loved learning about the social aspects of medicine, which was completely fascinating to me. And interestingly, I took some courses looking at the terrible things that happen in the pharmaceutical industry. So that kind of pushed me away even further from, the pre-pharmacy major that I had envisioned for myself. But UCSD was full of opportunities. I was able to volunteer at the UCSD Student Run Free Clinic where I would also use my Spanish interpret and translating skills there, as well as building relationships with the patients. And so by my senior year, I was able to take part in 2 internships, one with the Center for Management, Science and Health, and the other with the Research Center in Health Disparities, which is really where my love for health disparities grew. And eventually upon graduation, I got a job for a local nonprofit here in San Diego, where I hands-on work to address barriers in healthcare for underserved communities in San Diego, mostly in the Latino communities. And that was, very eye-opening. I did medical case management. And so I worked for about 3 years or so at this nonprofit, working with physicians and increasing access to care. And that was when I decided it was time to pursue my master's in public health. I attended National University, which happened to be right across the street from my work. So it worked out perfectly. And today I actually work in Alzheimer's education. I manage programs for a local nonprofit here in San Diego. And I am part of a lot of diversity efforts to increase access to education and resources. And also early next year, we'll be teaching at a university, which is opening up in January of next year. It's a public health and psychology university. So it's been great to really explore all the aspects in public health.
Thank you so much, Elizabeth. And then our last panelist that I will introduce is Kyle Underwood.
Thank you. Hello, everyone. I'm Kyle Underwood. I am currently a graduate student at the University of Southern California in my second year of getting my master's in health administration. I'm also currently working for Providence St. Joseph Health and Strategy and Business Development around their local region in SoCal, as well as their value-based care approaches with their health network. Prior to graduate school, I was actually a UCSC BSPH student. I came in 2015 and really from the very beginning was always into public health and really found that this is where my passion lied. A little bit about me that really led me to that route is I grew up having a lot of healthcare challenges that really allowed me to see the patient perspective and allowed me to understand, the things that don't do so well in our current system and the things that are well and how we can really make improvements on that. During my time in undergrad, I got involved in a couple opportunities. I worked for Palomar Health as an intern, working for 2 years in a variety of administrative roles and really getting a feel for how a community health system is run. And I also was able to dive into the digital health space, working for a startup aimed around telehealth and surgical decisions for patients. From there, I've also been involved in some work along patient advocacy. That's really where my passions lie. I was recently had an opportunity to go to Washington, D.C. and do some work on the Hill around newborn screening and rare disease funding. With all that, I'm actually going to be going after graduation in May, pursuing an administrative fellowship at the Cleveland Clinic. That'll be a 1-year program where I'll be training under a variety of leaders. I'm super excited about that. Some things I look forward to doing in the healthcare space, especially in healthcare administration, is really being able to bring that patient perspective to all the decisions that are made and looking to see how we can improve patient experience as well as improve value-based care and tie financials to outcomes rather than the current model of fee-for-service. It's all about me. One other thing is I really enjoy the beach and spending time with friends and family. I'm happy to be here. Feel free to reach out to me at LinkedIn or my email. Happy to connect.
Thanks so much, Kyle. And now, as I said, we will actually be starting a panel discussion with our panelists. I'm going to attempt to stop screen sharing here so that maybe we can actually see our panelists properly. All right, there we go. So I wanted to let everybody know that we did get several questions from attendees. If you have a burning question, please do go ahead and send us a question in chat if you are an attendee, and we will do our best to try to ask it. We have a little bit of time to get some questions answered, and hopefully we can get some different perspectives. We'll start here. The first question is actually, what made you decide to pursue your graduate degree or degrees? And for those of you who have more than one graduate degree or are pursuing a second degree, why did you choose to go the route of additional schooling? Now, some of you have already actually spoken about this, so I do want to be mindful of that. But I also know that a lot of students are considering sort of what route they want to go down, and so it is a very pertinent question. Anyone, or should I just start calling on people? How about, no, go ahead, perfect.
Okay, so I'm obtaining a medical degree, and then we'll also have my MPH now. And I think before I got into medical school, I was really thinking about whether or not I wanted to, pursue a program that was going to take longer. I thought at the time that 4 years was a long time. And being at the other end of it now, finishing up about halfway through my 5th year after doing the MPH, time goes by fast, and it's going to go by regardless. And so I felt really happy with my decision to take only 1 extra year to pursue the master's in public health. And I really saw my future as a physician as working working for communities. And I didn't see, in medical school, you learn like pathophysiology and medicine and everything, and you don't really learn how to, I think you inherently become a leader, through medical school and your position and the privilege you're given with your MD, but you don't necessarily learn how to do that in ways you can really affect change. And so intentionally knowing that was where I saw myself as a physician, I felt like I needed the extra support and tools and guidance through a different degree. And so I was really happy to study at UCSD and get the MPH and continue being a part of the UCSD community during that time. And I just felt like knowing where I wanted to go in the future and, thinking about all of the different degrees I could pursue, I felt this was the best combination. I also feel like public policy degrees are really important for, healthcare leaders. And so that's another great route I think that you can take. But that's kind of my perspective of why I decided to do a double degree.
Excellent. Any of our other panelists, especially those with dual degrees, want to speak up?
Hi, Alyssa. So this is I can provide some different perspectives. I do not have a dual degree, but I think my experience may be similar to many other students who had this question. So actually, I do not have a healthcare background or biology background in my undergraduate school. So in my undergraduate school, I come from a software engineering and finance background. So I'm really interested to become a financial analyst, or back in the day, I think it's called risk management or something like that. So I think in my junior year, I took an internship at the Merrill Lynch as a risk manager, risk management. Something related with the risk management is an entry-level analyst position in the financial industry. So 3 months in New York City is actually not the way I expected. So I think that's also why you should do interns in the way you undergrad school and keep exploring. So from the internship, I realized that making money is good, but it's not something that I really want to do for the rest of my life or for the future 20 or 30 years. So I talked to so one good thing about UPenn is that it's very easy to talk to different professors, even though those professors actually not necessarily has common areas or research or same research field. So I reached out to some Penn medicine professors to see, if there are any medicine or healthcare related project I can do. and I unfortunately I had some kind of this kind of project, and I feel like I can go with the biostats or biostatistics and I can imagine myself doing this kind of work, and no matter it's in the industry or academia, I can do this kind of work for a very, very long time, much longer than the financial analyst or in the financial industry. So that's one of the main reasons that why I make the transition, from the finance or a little bit more tech background to the healthcare or public health focused biostats focused field. So yeah, so I think the takeaway is that just keep exploring. I assuming that most of the attendees today are undergraduate students, and you guys still have time and chance to explore the field that you think you might be interested. So do it. I know the pandemic may be a little bit challenging for us, to talk to other people, but still keep that mindset. And I think whenever you get a chance and to explore, take it. Yeah. So yeah, that's my experience.
I'll add on. I think, when I was in your shoes, and it wasn't that long ago, so, but I think it's hard to think, okay, graduate school, I just got into college, I'm starting my undergrad, already thinking about graduate school. And when I was looking back on it, it was really a matter of, where did I see myself going in the future, and what did I really want to learn and kind of learn more. And I think if you look at graduate school, it's an opportunity to try something new and expand on your passions and really focus on what you want to do in the future. For me, it's very unique because being an MHA, it's a mixture of business and healthcare. And a lot of the MHA programs and a lot of the healthcare leaders, typically the entry level into getting into a health administration role is having that degree. I think healthcare in general is very graduate level heavy, so that can be shared amongst the rest of the panelists. I think ultimately it came down to speaking with my mentors, faculty, and getting some great advice on, where do I see myself going? How would the graduate degree get me where I want to be? And then from my experience now in doing graduate, school, especially in a Zoom environment, I realized that it opens up a whole new set of opportunities and doors that you might not have gotten just from an undergrad. And I'm so thankful I did it. So that's just one of the things. And I think also it is a financial decision to do. And I think making sure that that's something you're willing to take, but also understand that there are resources and supports out there to help you with that.
Shelton, I know that you got an MPH and you're in a PhD program right now. Do you want to share kind of why you had decided to do both?
Sure, yeah. So I was going to speak up. Embarrassing for you to have to call on me.
It's perfect. It's okay.
No, but just definitely echoing what other panelists have been saying already, and just to build on top of that a little, definitely explore and keep your options open. I think for me, it was a privilege to be able to do both my BSPH and MPH at UCSD, because having that span of a few years really allowed me to get to know and interact with a great range of faculty members on a much deeper level, in the sense that, I was able to help on a lot of different projects in the field of public health, ranging from health behaviors, risk assessment, environmental exposures, policy. I think that was really a great opportunity for me. So I encourage you all to take advantage of those opportunities, really take that initiative to reach out to faculty members, see where you can be involved in which projects, even if it's, on a really surface level, just go for it. Even if it's not requiring you to do a whole 4-year commitment, still just take advantage of that. Really be open as well to all the different public health opportunities that you might be provided with. Just because I never thought I would end up in environmental health right now, but there's so many different ways to address just one disease. Currently I'm studying lung cancer, and that's what my interests are, but I never thought I would take it and address it from an environmental perspective. So that's just a really specific but simple example of keeping your options open. Public health, especially right now, most of you are undergrads, maybe some master students in here. You guys, you all still have a lot of time to develop that passion, and it's never too late to change that passion either. But I think it's, again, really important to take that initiative, but also at the same time, take it slow too. It's not a rush. It's not a race, right? Take your time. I did take a gap year after my bachelor's to work in clinical research. Realized, that was something more along the lines of what I wanted to do. So that's why I pursued my master's and then now my PhD. So hopefully, I could lead my own research trials and whatnot. So if that's something, you want to do, then maybe you could look into that. But otherwise, there's so many other options that are available to you. And I think another panelist was saying, there's many ways to get to your, career or passion as well, right? So there's academic career, but also like work experience. That's really important as well. So you don't have to, go from bachelor's, master's, PhD, MD, like all consecutively. You might burn yourself out, in fact, if you did that. But definitely, take a year, maybe a gap year, or even if not, you could work while you're learning as well, part-time, just to get some real world experience. I think that's really important. And I think graduate schools and employers will really value that experience. And, in your application and interviews, they can see it that you're passionate about public health. I don't think you really have to push that much, but, if you're really involved in it and you are passionate, it will come out through your interviews and your application and just getting to know the faculty members.
Now, Sneha, does that resonate with you a little bit? Because I know that you also have both the MPH and you already have your PhD. You just completed it, correct?
Yeah. I was actually just going to say I would echo everything that Shelton just said. I think for me, the reason I initially went in to pursue my MPH was because I feel like I really only had come to the realization that public health was something that I was interested in very late in my undergrad career. And then it felt like I had just kind of gotten the ball rolling. I feel like each step that I took, I think a lot of other folks have said this, it opened up new doors. It also just made me realize there was a different way to address something and get at an issue that I hadn't really thought of or realized before, because that hadn't been something that I was made aware of before, which is also, I think, why I went into my PhD. I had the momentum, I had gotten the ball rolling. I took a year off in between and I was working. So I think that was why I chose to do it at that time, was because I kind of had the momentum, and I also really wanted to hone in a little bit more on a specific issue and learn from specific folks in the field as well.
Excellent. Elizabeth, did you have anything that you wanted to share on this topic?
Yeah, so after graduation from my undergrad, towards that tail end, I had the two internships that I mentioned with UCSD, and those were really eye-opening for me. And I knew I wanted to pursue a master's eventually, but for me, I did say I waited about 3 years, and I'm very glad that I did, because I did get that very valuable work experience, and really everything that I learned in my undergrad, kind of seeing that through in the work that I was doing. But also what kind of drove me to pursue the master's option was, of course, more opportunities, but also I wanted more authority, or more, just power in the decisions that I would make for myself, and I'd have more leadership opportunities, and I can implement different programs. And so, at least in the organization where I was working, I knew that this would be something of benefit for myself. And because I cared so much about the communities that I was working with, I wanted to have that autonomy to be able to design interventions and especially educational opportunities in a manner that was more culturally sensitive than what was currently being done at the time. And so I saw that as an opportunity to just, have that more autonomy and more control over the work that I was doing. So that was something that I would really like to highlight. And then also, not, to let everybody know, you don't have to rush through it. Take your time working, use that master's degree as much as you can. Let it help you and guide you through different opportunities. As was mentioned earlier, public health is such a diverse field. You can be working in education one day, advocacy the next. It's just, I just love the field because of that. It's just so diverse. And, I graduated with my master's degree about 5 years ago. So I have a lot of work experience since then. And I am looking to pursue a PhD eventually, probably in the next year or so. It's going to look different for everybody. If you're working, you can just kind of see, where you are in your career, and you kind of have to decide for yourself when it's a good time and when it isn't. So don't feel rushed. But of course, the more degrees you have, the more opportunities. And, I specifically would like to focus on research eventually, because I have been in the field. I've designed programs and interventions for different populations, but I would like to be on that research end of things as well, to explore different relationships and see how that information can carry over into different interventions. So there's just so much, and it's such an exciting field. So I just want to get that message out there.
It is very much an exciting field. So the next question that we actually have for our panelists is actually about your favorite and your least favorite parts of your graduate program. So if you can talk a little bit about, perhaps, if there's something like a practicum or clinical hours or something that maybe you liked or you didn't like, perhaps the structure of something, et cetera. It just might help our students to get an idea of what they might be looking at. Anyone care to start?
Hi, Alyssa, I can start. Well, put it this way, like in graduate school, graduate school is quite different than undergraduate school, and especially when you are in a PhD program. For us, we have a qualification exam, so the qualification exam always put us on a really puts a lot of pressure on our mind. I dream about taking those exams, and even now, even though I passed it, in my second year. So I feel like when so when thinking back, like does those how much positive effect does those qualification exam had on us in terms of research, in terms of teaching? I can't say much because we passed it, but really that we can think of it, possibly another form, maybe a qualification exam, something like that. So maybe I can say that that's the not so happy part of the graduate school. And then the happy part is that I think is that you can select some project that you're interested in, and at the UCSD branch, there will be many professors that waiting to help you, and you can find some good matches, potentially good matches, with some other professors, some professors doing the things that you want to do. And I think in terms of that, I think that's really makes you work, even though you're working, but it doesn't feel that you're working. So that's the good part. So I'm not sure I did answer that. did I answer that good or bad questions for the good or bad experience for the graduate school experience? But that's in general how I feel. And I'm also really quite happy to hear some other people's experience as well. Thank you.
Going along with that, there's a lot of exams in medical school. Also, there's MCAT to get in, and then step 1, step 2, step 3, which are all licensing exams that you do. And step 2 is actually 2 parts. So there's a great number of tests, and then you get every 10 years after you're licensed, you take another test to keep your license. So lots of tests, but I feel very comfortable with them at this point. So that's a hard part, I'd say. But the wonderful part, I loved third year of medical school. I knew I was going to do psychiatry kind of throughout medical school, but in third year, you get to rotate through all of the different specialties. And I loved my plastic surgery rotation. I loved my pediatrics rotation. And it was hard, but every day, I said to myself, I'll never get this opportunity again to be a surgeon, to be a neurologist, or whatever it may be. So and just like being with patients every day was great too.
I will expand on the MHA. We do not have a lot of exams, so that's not our issue, but we do a lot of networking for sure. But I guess if I were to say one really exciting thing about graduate school is, you really get to kind of go into what you like to do and kind of work on your interests and specialize in certain things. And with that, the discussion based structure and ability to really, talk about things that are really meaningful or exciting. One thing that I would say that's unique to my program, and it's similar to others, but it's having this practicum or residency experience where we actually get to work within the field with leaders in healthcare and getting to not only learn various skills and things that are applicable to the job, but also being able to develop as a person and professionally. I think that's something that graduate school has really allowed me to explore and develop and grow as a person and a leader. If I would say the one thing that maybe is kind of a downside is really, from undergrad, I feel like it's very structured. And when you go into graduate school, it's a little bit unstructured. So there's a tendency to, feel like you're kind of lost in the shuffle because you're not sure what direction to go. But ultimately you get there's always, you have your peers and your faculty to help you guide you along the way. And I think also the one other thing that I don't like about graduate school, the night classes can be a little bit intense, but it's cool.
Yeah.
Anybody else want to share something, or we can move on either way?
Oh, just to quickly build off of the other panelists too, would say sometimes the downside, yeah, definitely could get a little overwhelming with the course load and workload, exams, assignments, whatnot. I know not myself, but a few of my cohort members have already gone through like a crying phase already, but now they're over it. So it's just something to get used to. But at the same time, by the time you're by the time you're in your master's or PhD or MD program, there are certain courses that you are, much more passionate about. So hopefully those courses can always, brighten up your day and balance out those courses that are really just, to get it over with, right? But another thing I would say, the great thing about graduate programs, I would say, is usually it's a smaller cohort. So you really get to connect with and get to know your cohort members, more than just classmates, but you could be friends, potential future coworkers. So yeah, I think that's a great time to network as well. I know I'm still keeping in touch with a few of my members from my master's program and currently in my PhD program as well. So that's definitely a really positive thing that I have enjoyed.
Excellent, thank you. Sneha, yes.
Oh, sorry. Yeah, I was just going to say, I think
ahead.
I would agree with what other folks have said, that I think it can be definitely a challenge to navigate the transition from undergrad to grad school, just because of, it's a lot less structured. And I think particularly in a PhD program, if that's something you choose to pursue, I think you're very independent at some point. And I think that can be definitely challenging, but ultimately often the goal of getting a PhD is to be able to have that independence in your work. So it's definitely like good preparation for that. But I think it's also very helpful to have the help of advisors and other classmates, faculty members to kind of lean on to navigate that kind of transition. And as was just said, I think the fact that things are a little bit smaller makes it easier to kind of forge those relationships. I think my, favorite thing about grad school in general for both my master's and my PhD was just the opportunity for kind of hands-on learning. Whether that was in my master's, I had to do a practicum, and in my PhD, I worked as a graduate student researcher with my advisor, and all of that just lent itself to some really good personal growth, professional growth. I think I just learned a lot through those experiences, and they were kind of built into the program. So it was something that was kind of there for me, and I didn't necessarily need to navigate it fully on my own, but I think just was really great for my learning and moving forward in my career.
Awesome. Thanks, everybody. The last question that I have is actually about what you did in college to help you in your graduate career. Maybe advice that you would give students interested in pursuing a graduate program like yours, activities that you were involved with, and other things that you felt like contributed to your success in graduate school. Perhaps Elizabeth, you want to start?
Yeah, so things that I did in undergrad. So yeah, I just wanted to, I mentioned this earlier, I know, but it's really important to just be involved in clubs and internships, volunteering, and as many things as possible that are, of interest to you. I found the internships that I did in my senior year to be extremely beneficial. And one of them, I mean, this was kind of like the beginning of me realizing that health disparities exist and just all the different things that I read about but didn't really see in real life. And I was able to, write articles about different health issues that were going on. For example, in City Heights, we were able to go out into the field, interview, and then write these amazing articles to highlight these issues that were going on, for example. And the other internship I did with the Center for Management Science and Health, I worked with Dr. John Montanesi in this research study that he was doing to evaluate the patient-doctor relationship and the communication specifically. Is the doctor understanding what the patient is saying? Is the patient understanding what the doctor is saying? So these things that we don't really think about day to day, but they're extremely crucial to understand and build interventions around. So things like that were interesting to me really pushed me into wanting to pursue a degree later on. So those really helped me. And then of course my work experience really just helped me understand everything that I had learned previously in undergrad and through my internships. So I think all of those things are really beneficial. So really look for those opportunities. UCSD has so much, and I'm really happy to see that, I graduated from there, 10 years ago. Just the differences and all the different resources that are available now that weren't available when I was there. So I'm very happy that all of you get to, take advantage of all of those things.
I can add on. I did briefly mention some of the things I did in undergrad, but I think some of the things that are important is really finding, a mentor or somebody that can really help you, guide you through this, your, collegiate career and also just your professional development. Something that I've done that's more focused around the healthcare community and the leadership aspect is get involved in SOUL, which is the San Diego Organization of Healthcare Leaders. It's part of the larger ACHE chapter, which is where healthcare executives come together and just network and learn how to improve leadership and things like that. And having a mentor through that program has been really vital. I think also being willing to just take, say yes to opportunities, know how big or small they are. I know I've done, internships that are more formal, but also just reaching out to my faculty or even just reaching out, maybe on a LinkedIn message to just say, hey, is there any opportunities or any way we can get a coffee chat around something? And I think lastly, really finding out where your passions lies and, something I enjoy. I think networking is really about building relationships, and the best way to do that is doing good for the community. So getting involved in community involvement, whether it be maybe a beach cleanup or doing some helping at a health clinic. For me, it's really about patient advocacy and working to advocate for those that maybe don't have a voice too. So that's, I would say, just keep on, build those relationships and just build yourself as a person.
I just want to add that I often tell students that to pursue opportunities that you are really passionate about, not that you think a program wants to see, because your passion and your leadership and your commitment and all of these wonderful qualities are going to come out if you are personally interested in an organization. So I was only a part of a few organizations in college, but I stayed committed to those organizations because I wanted to. And then I moved up in leadership positions in those organizations. And for medical school, they want to see you having leadership positions. So I was happy to pursue those leadership positions because I loved what I was doing. So try not to spread yourself too thin, which kind of answers like the burnout question a little bit, but you know, just be passionate about what you're doing, be curious, and if it's not serving you in ways that are not nourishing, then find another organization. There's so many, like so many people have said, there's so many opportunities out there. So make sure you keep that in mind.
And I know that there was a question that a student had asked in chat. I know Sneha and Shelton, you please feel free to jump in as well. But I know that there was a student that was asking in chat whether people are still able to opportunities in graduate school and beyond. Are you still able to be involved with organizations, et cetera?
Yeah, so I can answer that one. So the internship opportunities that I mentioned earlier, those were open only to fourth year students that had taken specific courses. But in terms of you know, other opportunities, you know, in San Diego, where there are over 12,000 nonprofits just in San Diego alone. And you know, I'm going to talk about nonprofits because that's all I know. I've been working in them since 2010. And so there's vast amount of opportunities. Right now I work for the Alzheimer's Association, and I mentor students, and specifically MPH students. And so, I mean, we have opportunities there. I mean, there are just so many different organizations. It just depends on what your specific interests are. You know, you can go to volunteermatch.org, Handshake, you know, all those different websites. And, you know, I know right now it's a little bit hard with everything being virtual, but there are opportunities nevertheless. So just keep looking, and I'm available if you wanted to chat with me. I'm happy to share resources, but there's a ton of opportunities in San Diego and beyond. So do look for those.
Yeah, I agree. Just to build off of that, you know, definitely when you get into a graduate program, your workload, you know, might be more or a different type of workload, but as long as you're able to manage your time effectively, really have a work-life balance, you know, I think you could definitely pull that off. And just, you know, to further that a little bit, I think that's one thing that I, you know, worked on a lot when I was an undergrad, was that helped me in, you know, my graduate degree, both my master's and currently my PhD, is, you know, time management. I think it's really important to be able to have that work-life balance, and really know, you know, when not to push yourself overboard. You know, for me personally, like, I set a time each day when, even if I don't get a certain work done or assignment done, it's kind of like a cutoff time for me. And, you know, I go either take a jog, go for food, boba or something like that. But it's really important to just see what works well for you. You know, don't try to push yourself too hard and work too hard. You know, I think there's self-care is much more important than that, and there's much more to your life than just school. And, you know, that's really important. And like I said, when you apply to programs or employers and jobs, they will be able to see that, just like the other panelists have said, you know, your qualities will show and your passion will show through that. You know, your grades and classes will say one thing, but your involvement and your passion, you know, says probably a lot. I would say much more than that.
Just gonna say also, I think a lot of MPH, MHA, like a lot of master's programs also ask that you do some sort of a practicum or an internship or something like that. And I think those are really great opportunities to kind of learn what different spaces look like and what you might want to do post that, if that's kind of the route that you choose to go. For me, that was, you know, engaging in research and going abroad to work on a research study, but I had classmates who worked at nonprofits, who worked at NGOs, who, you know, worked for government, worked for the CDC or the WHO, those kinds of things. So I think it's, you know, if a master's, an MPH and MHA is something that you are interested in, I think that's a really good, those internships or practicum, that's a really good opportunity to, it's a good idea to leverage those to kind of think about like what you want to do after that.
you all. Now, we did have a couple of additional questions that came to us in chat. One of them that I think really is very timely right now, and a couple of you touched briefly on it, is how do you avoid burnout? Several of you were discussing about how much more work it is in graduate programs and things like that. How do you personally find ways to avoid being completely burned out?
I can go ahead and answer that one. Yeah, so it is very timely. You know, I think it's harder than ever to focus and, you know, keep a balance of all the craziness going on in everyone's lives. But, you know, as it was mentioned earlier, self-care is crucial. I mean, and especially in public health, you know, we're public servants, we're helping communities, we're making impacts on a large scale. And so it's very, very important to, you know, kind of reflect on yourself, be present. I know I take some time to exercise, which can be a little difficult sometimes, but very necessary. And, you know, health promotion is my thing. So I have to practice what I preach, which can be very difficult sometimes, but you kind of just have to force yourself, you know, it's good for you. You know, you can't help others when the glass is, you know, half full or half empty, however you want to look at it. And so you kind of have to take care of yourself first before you can take care of others. And I think that's very, very important. You know, when I teach classes sometimes on healthy living for seniors and things like that. So, you know, I always try to practice what I preach, and healthy eating is very important to, you know, don't have chips handy because you're going to go for those, and that's going to make you feel, you know, crappy afterwards. So just focusing on your diet, your exercise, you know, drink a lot of water and exercise whenever you can. If you're not big on exercise, you know, do some stretching, maybe some meditation, but focus on, you know, one or two things every day that are going to help, you know, with your breathing. You know, breathing exercises are really helpful. You can do that when you're sitting at your desk working. You don't have to go anywhere fancy. So just find something that works for you and just stick to it. And I think that can be very helpful in the long run.
I think, you know, burnout is something real and something we're all experiencing, especially right now. One thing that I feel like that's really helped me is to take some time aside to really focus on a passion that might be outside of my professional or educational realm. You know, healthcare and public health, it can be a daunting task, and there's so many things that you can get involved in. But really taking some time to like maybe separate and do something totally different. Like, you know, I'm a big walk on the beach kind of guy, or cooking or things like that, and taking that time for yourself where you can kind of really, you know, step away from the that environment, especially, you know, currently, you know, my residency and like everybody else, everything's online, and it's easy to just keep on that computer all day. It's in your wherever your office or whatever. So making sure you take that. I think also just being, you know, understanding that you shouldn't be so hard on yourself. You know, you feel like we always have to do these constantly. You know, making sure that we're doing these opportunities or doing these experiences, or we're continuing to, you know, maybe we, you know, do this internship or make this connection. But the reality is that we're all in this together. We're going to get to where we're going to be. And then overall, just really taking time to reflect on your accomplishments and knowing that, you know, things are going to happen for a reason. So that's me and my motivational pitch for you all. But yeah.
I think I'll also add that going back to your intentions is really important. So many times when I was like really struggling to study, I would read my personal statement for medical school and remind myself of why I was doing what I was doing. And for who I was doing it for. Doing it for myself, but as like I kind of mentioned in my introduction, doing it for my parents and my grandparents who had a lot more barriers than I did when they were pursuing. My parents were pursuing their education, or my grandparents working in the field. They had a lot more challenges than I did. And not that you need to compare like challenges to challenges and barriers to barriers or any of that, but that helps me and keeps me grounded in what I'm doing and why I'm doing it. And then just thinking about, you know, who I'm going to serve in the future, and knowing that all of these like difficult steps and late night studying, if you don't cut yourself off, which I would have had kind of some of those tips when I was in undergrad and things like that. It just helps keep things in perspective, so you can remember that too.
I think that's really great advice, and I think I've been reflecting on burnout a lot recently, and I think it's such a good idea to like go back to what your intention is. I think it's very easy in grad school to kind of get sucked down a hole and do kind of what you think you should be doing or what other people think you should be doing, and really, I think an important thing through that process is to really focus on what brought you to that field, that program, whatever it is in the first place. I also think it is very helpful to have people around you who are going to kind of hold you accountable, not for your work necessarily, but for your self-care, whether that's like supportive classmates, your family, friends, an advisor, somebody like that. I think kind of being around those people to check in with you and make sure that you're doing okay, I think is also a really important thing. So definitely, like, as you're going through that, don't devalue the importance of those relationships.
Right,
That's a
and
great segue. See, sorry, Shelton, go ahead. Sorry.
just to quickly add on, I agree with everyone, everything the other panelists have said, but also make sure to be communicative too. It's I think a big thing with workload. So whether it be homework assignments or even if internships, workplace, be transparent with your professors, your employer, your bosses. If if you need a break, let them know if there's something that's taking priority right now or something that you need to do and handle, and need a bit of time off. Just make sure to tell them that and explain to them your situation, whether or not they agree with it or not. That's another story, but as long as that you've done your part and and are transparent about it and communicate to them about that, I think that's really important to understand and recognize, and also not be afraid to do.
Sorry, Lisa, I really want to add one more thing. I also really encourage you all, if you want to, if you're curious about it, to seek out mental health services in the form of therapy. I personally have been in therapy I did it throughout college, and I've done it throughout medical school and plan to in the future, because you don't need to have an acute crisis or anything that's happening in order for you to seek therapy. It's just a really great, it's a person who is objective in your life and who's there to support you through whatever you're going through. Even if you feel like you're in a really stable place in life, whatever that looks like for you, I think it's a great, service, and you have it through the school. And so, always, if that's something that you might be interested in or have been curious about, just try it out, see how it goes, and it can be really helpful.
Exceptional advice. Thank you so much, Cecilia. That's an excellent reminder to everyone that therapy and mental health services are available through CAPS, the Counseling and Psychological Services here on campus. And they have drop-in clinics, and they have group counseling, and they have individual counseling available for students. So the question that came up in chat that I was going to say that Sneha's comment was an excellent segue to, and it actually, it works with what Shelton and Cecilia said as well. One of our attendees was asking what you do if any of you have had people that were close to you, friends, family, mentors, etc., that disagreed with any of your choices about graduate school or your specific programs, your timing, exactly sort of how you went about going to graduate school. Did any of you have an experience like that?
I'll just say something real quick about that. So I think particularly in my family, it was a little bit difficult to explain what public health was. And health is either you're a doctor or you're not. And so I had to explain, what that all was. And I still don't think this many years later, it's exactly clear what I do or what my degree program was. But they do, my family does see the impact that I made, and they see that my passion about it. And so they're happy with that. And but yeah, it was a little bit challenging in the beginning just to explain what it was. But I think, you know, when you really like something, if something, you know, lights you up, if something, you know, you're passionate about, you just go for it. Don't worry about what other people are thinking or saying. If this is, you know, something that's a true calling for you, you know, go ahead and do it and be the best that you can be at it. That's the best advice that I can give. You know, it's, for me, it's, you know, I wanted to go into a field where every day I feel fulfilled and where I'm making a difference. And so, you know, this is the field for me. And so I'm happy to be in it. And if anybody else in my family wants me to explain it to them, I will explain it all day, as many times as I need to. But I'm very proud of what I do. And I would, you know, encourage all of you to be proud of, you know, what you're passionate about and just be the best that you can, whatever it is that you choose.
And something that it looks like Cecilia had intended for all attendees. She says, if a mentor is not supporting you, find another mentor. There are so many people out there who can guide and support and guide you in your interests and passions. And I agree with that. I think that's excellent advice.
Yeah, just to also address that previous question, I definitely had that experience, you know, when I got into Harvard's program, you know, I was really excited. So, you know, if a family member, you know, isn't as excited or isn't happy for you or feels differently, it can be hard. I've been in that situation where my excitement level was, you know, off the roof, and I had a family member who wasn't as supportive. But just like Elizabeth was saying, you know, I think it's definitely really important to just stay true to your passion and think about, you know, why you are in public health in the first place. And also, you know, just like what I was saying a little bit previously, as long as you've done your part to explain it to them and really tell them and share to them why you want to do what you want to do, you know, that's really all you can do. And then, you know, the next step is really for them to either accept it or not accept it, be indifferent to it. But really, as long as you realize why you want to be in that field and pursue what you want to pursue, that's the most important. And I think, you know, those around you, if they really care for you and whatnot, they will for you eventually once they in that place that they can see you're happy and that you're doing meaningful work that you truly care about. You know, that will show and come out to them as well.
Thank you, amazing panelists. I did want to just ask if any of you have anything else that you wanted to share. We just have a few more minutes. And so if there was anything else that you wanted to make sure that our attendees learned today, please speak up now. Otherwise, attendees, just a reminder that there are ways that you can contact the panelists are listed on each of the panelists, the panel pages on the presentation. The presentation will be available on our website.
I guess I just want to mention one more quick thing. It was kind of touched on earlier, but just in terms of deciding on what school to go to. So one of the things that I appreciated about my program was the really small class sizes, which was very refreshing after attending UCSD for a science major. You know, I wasn't in a class with 100 or 200 people anymore. I was in a class with maybe 20. And so I thought that was very beneficial for my learning, but more so with relationship building. So not just with your peers, but with the professors. Especially, you know, if looking forward to the future, if you wanted to pursue like a PhD or another degree in your future, it's very important to make those relationships early with your professors. They can really help lead the way. You know, that's been huge for me personally. And, you know, letters of recommendation. And, you know, sometimes professors have projects that they may include you in. And so I can't emphasize that enough, to build those relationships with the staff, with professors, because that can really help you in your career and just any other future goals that you have. One of my professors for my program, he actually took it upon himself to open up a brand new university, and he's doing that next year. And he asked me to teach with him, and that wouldn't have been possible if I didn't have that relationship with him. So over the years, keeping in contact with professors, checking in, how are you doing? Can I get a letter of recognition? That kind of thing is just really, really beneficial. I can't stress that enough. And I'm glad I did that. But I didn't really know that in my undergrad. So whoever this may help, do take note of that, because it's just priceless.
I was also just going to add, in terms of mentorship, you don't need to have one mentor. You can have a lot of different mentors who you go to for many different things. And I think that can really add a lot of value to the perspectives that you see and kind of the learning that you gain from them. I also think it can be really beneficial. I think I've reflected on this a lot. This isn't something that I did enough of earlier on, is just kind of talking to people about their experiences, their their perspectives, their career paths, just to kind of understand what the different options are for you and whether you see yourself in any of those different spaces. I would definitely say, don't be afraid of reaching out to people. I think more often than not, people are more than happy to talk about themselves and their career paths, and just be there for you and in whatever capacity that they can, and trying to be intentional about the questions that you ask to kind of just make the best use of everyone's time. But I definitely think forging relationships and maintaining relationships is such a huge part of moving forward in your career that I think you're not necessarily told enough early on.
I will add on one quick thought. One of the things that I always get asked is your personal statement or application, what do you do to stand out? And honestly, you just work on, just be genuine, be yourself. It's your story. That's what they want to hear. And I think if you just speak to yourself and what your ambitions are and why you're going into the set career, that's all that's going to matter. In the end, the best way to show the admission committee, whoever it is, it's really talking about yourself, and that'll lend itself in your personal statement or the conversations you have. So be yourself, be genuine, and tell your story.
And also just be so confident in who you are and in those passions, because I will tell you that everyone I think a lot of people experience imposter syndrome, from undergrad all the way up to, the surgical attendings, the, medicine attendings, in my world, all of these people are experiencing it, and they're not sharing about it, but a lot of people experience that. And so just be confident in where you are, know that you have a right to take up space and take a place in your programs and the programs that you want to pursue, and just know that representation matters and is so important. And so that means that you, with your story, with your journey, belong where you end up, and your role is important in all of those spaces.
Yeah, definitely just echoing what Cecilia said, kudos to everyone, here for being in public health and being involved. Just like she was saying, your role is important, especially, could understand during these times it might, for some people, be really difficult to stay dedicated to public health. And, at times you might be questioning, why you're in public health, given some certain circumstances. But I think, aside from that, it's really important to realize and recognize that your work is valuable, and your passion and your goal for public health, that's important, and really it will make a difference in the future.
Well, I think that's about it, and think we're out of time. But I just want to thank all of our panelists and Nadia from the Career Center so much. Thank you all for taking time out of your busy schedules to be with us today. Thank you for volunteering. Thank you for being open to being contacted by students. We so appreciate you. We wish you all the best. And we want to hear where you are in a few years, see how things are going. We're so excited for your futures. Students, thank you for attending, and I hope everyone has a wonderful night. Bye.
Thank you so much.
Bye.